All right, let's get started. Hello, everyone, and welcome to New England HIMSS webinar series presented by premier sponsor Stat.io. Today's webinar, From Numbers to Nuance, Strategic Leadership and Data-Driven Decision-Making in Urgent Care, will be presented by Michelle Johnson and Alan Buckham. Michelle Johnson currently serves as CEO of Happy Health, a federally qualified health center lookalike delivering accessible quality healthcare across North Alabama. And then we have Alan Bucknam, who is co-founder and CEO of Stat.io, leading the company in its mission to improve the patient experience through operational efficiencies. Okay, a couple housekeeping items before we start today's webinar. Following today's webinar, a survey will be sent out to the group, including a section that you can use to ask any questions that did not get answered during today's session. And then an email following this webinar will also be sent out with everyone's instructions to claim any CP HIMSS credits that you may need. We will also be posting a recording of today's webinar to our New England HIMSS YouTube channel, and we will post the link to the video on all of our socials. Lastly, I know I spoke about this at the top of the hour, but you can use the Q&A feature at the bottom of your screen to ask any questions you have for the presenters. And with that out of the way, let me hand it off to Alan.
All right, excellent. Thank you so much. And thanks everybody for joining. Good to be here and excited to be sharing the stage here with Michelda. Michelda, thanks for joining.
Thank you, Alan, for the invite. I appreciate it.
Awesome. Well, we'll jump in here. A little bit of kind of an agenda. We're going to do some introductions. Want you to mostly get to know Michelda some, talk a little bit about some of the gaps and the challenges of healthcare leadership, and really what Happy Health and Michelda have done to support their patients and to provide great human-centered healthcare in their community. I won't read this necessarily, but I want to share kind of a fun story. When Michelda joined Happy Health, she had a trip planned to come out to Utah for our annual summit for STAT. And when she and I met for the first time, she mentioned, "Hey, I'd really like to ski. I'd really like to try out skiing." And I've been skiing for quite a while, and I have taken many people out skiing for the first time. And it has never been an experience that I think they would want to repeat. It's always the first day skiing, I think categorically, is not a good experience. And so I shared that with Michelda, and her response was, "What, you think I can't handle it?" And so she came out, went skiing first day, and from everything, I wasn't actually able to be there. From everything that I hear from Michelda and everybody else who was there, number one, she was a complete natural on the ski slopes. And number two, she and everyone else around her had a great time. Is that a fair statement, Michelda?
That is absolutely a fair statement. It was an amazing trip. First time on the slopes. I fell a couple of times now, so let's share that piece of it. But really had a great time.
Yeah, and my understanding is that no physical therapy or counseling was needed in the immediate aftermath of the first day skiing, which I think is better than most.
Well, a little icy hot though. A little icy hot was on deck, but
Awesome. Well, Michelda, this everybody can read the screen here, but maybe do you mind just sharing a little bit of your background and kind of how you ended up in your current role and a little bit about about yourself? I think that'd be really interesting for people.
well, thank you, Alan. Thank you for the invite and the introduction. It's one of those things, right? I had a conversation with a friend, and I was trying to make a decision. Should I do this or should I do that? And her advice was just say yes. And what you realize is that yes will lead you to the next yes, that'll lead you to the next yes. And before you know it, you're really in the middle of purpose and doing the things that matter, that leave the impact that you desire. And I mean, I could go through all the background, but that's not the most important part. The most important part for me is finding that level of what am I purpose to do? So background in entrepreneurship, serial entrepreneur, opened the first edible arrangements franchise in the state of Alabama, multiple locations, sold those, had an HR consulting business that I sold. And partnered with Northwestern Mutual on, and in the middle of all of that, really passionate about healthcare, doing mission trips, and Happy found me in a place that I was a little bit kicking and screaming. I was living in Atlanta, and had said I'd never move back to my hometown of Huntsville, Alabama. But when I tell you all things work in accordance to the way they are supposed to, and it's been a delight to really understand the vision and mission of the organization, and then have the responsibility and accountability for health equity, right? To make sure that every single individual has access to quality health care. And so Happy's mission is just that we're a federally qualified health center look-alike, and really able to serve the community. And we enjoy doing it. And so I started as the CEO of Happy September 6th. So it's been a year. And I've had a little bit of nostalgia happening in looking back at, what I inherited. And we'll share some of that today in the presentation of where things were and where they are today. And I have to be honest, Alan, and say the data is staggering. And I'll share a little bit from my perspective in that, when I walked in the door and heard of, sync times at the time, stat now. My first question to the leadership in our first quarterly review was, who are you? And what are you doing for us? Like, really get me down to why should we continue to have your organization? And it's just been an amazing partnership since then. And I'm really glad that we've continued to work together.
Yeah, excellent. Yeah, one of the things that I find fun is we work at STAT with organizations across the country. The majority are community health centers, so it's kind of this niche of healthcare serving the underserved patient populations. It's a group of safety net providers, mostly providing primary care, doing so in really innovative ways with challenging environments, challenging patient populations. And to me, Happy Health is uh, doing all of this on like extreme difficulty mode, working in community health in an area that I think is wildly less funded relative to other areas. And Happy Health is a lookalike, which essentially means that they don't get some of the financial benefits that other community health centers receive. Every dollar that comes in the door is a dollar earned from seeing patients, and they are also seeing patients that don't pay, or maybe they pay $20 for a primary care visit. And Happy Health, just very mission oriented, but also pretty cool, I think, story of, taking what you have, and that might be a shoestring in one hand and a stethoscope in the other, and saying, "Hey, we are going to provide great patient care for our patients." I think that's a pretty amazing story.
Yeah, I have to echo that. It was a very surprising story because I was, a year ago, new to federally qualified health centers, and then understanding that distinction in a lookalike, which means we have the rigor of compliance with HRSA, operations guidelines, but without the federal funding. And so we are fully operational health center, as you can see from the slide there, seeing, according to our UDS results in 2024, 11,123 patients with over 35,000 encounters. So seeing a lot of patients, and truly boots on the ground, really making sure that we are assessing the needs of our community and then looking for creative ways to fill that data. Huntsville has been in the news recently as the new headquarters of Space Command. And, whatever the implications are of that, what it really means is that although we have growth, we also have a widening divide of individuals who may or may not have access to healthcare. And what I've learned in this year is that we are still only scratching the surface of somewhere between 7 and 8% of utilization from the patients and the demographics that really need the services. So there's still much more that we can do and have to do to impact at least my slice of the world in Alabama.
Awesome. Well, I think we're excited to dig in a little bit deeper. I'm going to give a little bit of context here, just on STAT, who we are, and kind of where we came from. So I worked in a healthcare organization in Washington State, and we were looking at some of these challenges around efficiencies. As administrators, we didn't feel like we had the data that we needed in order to make the right decisions, and also in order to lead our teams to the right outcomes. Sometimes, we had a strong hunch that we knew what we needed to do. And when we presented to the team, we'd be presented with kind of anecdotal evidence. Well, here's what we think is happening. And we didn't often have data to get kind of both of those parties on the same page and ready to move forward together. We needed to find some data in order to better align administrative leadership and the caregivers that were taking care of patients. And so STAT came out of that organization. We built kind of a prototype of this, and then we started having other organizations that were touring our facility that were, we'd become a fairly best impressed or best in class organization. And as other people toured, they said, "Hey, this looks really cool. Think we can, implement it? What does it take to build?" And our response was, "Hey, we're not a software company. We're not, building this type of thing." And eventually I kind of had a wild hair and said, "Hey, I think I want to go out and build that company." And so we worked out an arrangement where the health center profited and where we were able to take this out and start implementing it in other organizations. These numbers are probably a couple weeks out of date. We have 50 customers. There's 27 people on the team. Our customers span from beautiful places like Puerto Rico and Alaska and Huntsville, Alabama, and New York, and most of kind of the continental United States as well. This is just a little bit about like what the system looks like, and I think this is just a valuable slide just to help you kind of understand. On the top right, you'll see this communication tablets. We put tablets at exam rooms. These are used to communicate just what needs to happen next. This morning, I had a dental appointment, and you just hear people saying, "All right, where does the dentist need to go next?" They're making calls with their radios, and that's what these tablets are used for. Everything that happens on these tablets is driven either by someone saying they need something and tapping an icon, or they wear a badge and that automatically picks up where they're located throughout the facility. So staff are wearing this badge. This is used both for locating, but then also there's some safety functionality. In this case, you're seeing a code blue icon on that badge. There's a button that they can double press. Say you're in an instance and there's a patient who is getting vocal and is frustrated. You can double click that button and get some help. And kind of last but not least, everything that happens in the clinic is presented to an air traffic control view where you can see everything in each exam room, how long patients are waiting, what patients need, where your providers are, where your medical assistants are. And then we're tracking that data so you can look retroactively and understand what's happening in our clinic and what is happening on a by provider basis, which appointment types are taking longest, that type of information. That's just a very quick intro. Michelle, love to hear just a little bit. You mentioned kind of the story that I think is fun, which is, you come in, you're brought in as the CEO, and I think it's really important that we ask a question, and that question is, with the tools that we have, are we getting value out of what we have and what we're using? I'm just curious, Michelle, when you I know when you saw Sync Times Then, now Stat, we rebranded. Initially I think that's a critical question. And I think over time, you came to a place where you said, hey, this is actually something that, we really need to thrive in our environment. So I'd love to just kind of hear that story a little bit before we jump forward.
Yeah, because thank you for that. I'm a numbers girl, and execution is my love language. But the key is knowing what to execute on. And if I don't have reliable data, then it's more difficult to make those key decisions to say what's really going to turn the needle or make a difference in the overall operations of our business. And so I needed to have quick access to data to be able to say this makes sense or it doesn't make sense, and really then have the reliability of that data along with the historical reference. And so what I did find after spending time with, the team that was there, your team that was there on site, was this is how I can use the data. Because at the same time, I'm navigating quite a few things. I'm navigating, new city, new CEO to an FQHC, my first exposure to an FQHC. So I'm trying to get up to speed as well on what are those requirements? What do we need to do? What do we have to do? I see a lot of patients moving in and out, but not sure if we're truly serving the community well, and needing to put not just assumptions on that of what somebody says is the best thing to do, but really, how do I quantify that in a way that allows me to say what's the best next step for happy. And in the middle of all of that, we were looking for really what's our low hanging fruit? What is that low hanging fruit that says we can improve revenue by whatever percentage over whatever period of time? But if I don't know why patients are in or how long patients are in or some of the data that we're able to pull, it makes it difficult, right? And so one of the things that we would say the value is, or and I'd say it confidently, is being able to really quantify. Yeah, I've got 11,123 patients, but what does that mean? How does that impact the day-to-day operations and flow for Happy? And then how do I plan if that number doubles, if that number triples? Then what's my throughput? And how do I then analyze that data to say, how do we prepare for greater growth? And so the value was, once I understood it, once I could connect the dots and then access, the dashboards, the reporting features, and different things like that. So yes, you talk about the tablets in the room and I've got the TV console where I'm looking at the clinics on a day-to-day basis. But ultimately, the key point was really being able to access the data on an overall holistic standpoint and saying, how does this now impact the operations and the growth trajectory that I have? And I think the other piece of it, Alan, that was crucial for me, especially being new, was the benchmark data. So not only saying, how am I doing, but then you also provide this benchmarked opportunity that I can compare. I'm a little competitive, So when you challenged me about not being able to handle the ski slopes, I had to prove to you that I could. And so that competitive nature comes out. So as I'm looking at the data and I'm benchmarking, then I can ask credible questions on how do we get here? What do we need to do? And why does it matter? So that's the first part of it. But the second part of it is what I had to do, and I know this may be, and I may, just be jumping ahead a little bit, but the analysis of the data really wasn't just for me as the CEO, right? We use a system, we'll talk about that in a minute, but I needed my leadership to have ownership of the data, right? They're the ones sleeves rolled up in the trenches and understanding what are the nuances that's impacting the data that I'm looking at. But if they're not looking at the same data, they can't help me understand the story. But because, numbers are just numbers. The question is, what story can you tell related to the numbers, and then work through what's the story we really want to tell and how do we impact that? So it was not just bringing myself into the picture, but it was also making sure that our leadership understood that this is not just a system that helps you, click a button and your MA is going to run in the room, or you click another button and that prescription is sent to the pharmacy, which happens to be on site, or you click another button and there's a code blue in the room. All that's great and wonderful. But now what do I do with all of that data so that I know how to be more efficient in our clinic setting?
Yeah, I love that. Execution is your love language. That's super fun. I think what you're talking about with data is really this idea of in healthcare. I think especially often we have getting data as a challenge, but then we don't often use the data that we have effectively, right? And I love this story you share about, hey, if just the CEO is looking at this, doesn't matter how big or small your organization is, that's just not good enough, right? If you measure something, it will improve, but if you measure that and share it with the teams, it's probably a lot better. This is kind of one of our fun terminologies we use. We talk about data altitude sickness. This is an idea that essentially in healthcare you have a lot of data collected at the point of kind of the point of care, around billing, around clinical information. Stat is unique in that we really focus on the operations side. But you collect all this data there, and then it goes up the mountain to, the leadership team, and they're looking at this data. And what we've seen is that sometimes data altitude sickness happens there, and the data never gets back down to the team. And so the message there is don't let the data die on the top of the mountain. The purpose of data is to get us all aligned on the story, to get us all aligned on the goals, the outcomes, the things that we need to prioritize, and use those things day in and day out. But if the data is only on the top of the mountain, you're not getting anywhere near the value out of that data that you should be getting.
Right. And that's, I mean, that is so key, right? Because data, when used effectively and impactfully, should really change behavior. And if I'm going to change behavior, I know that I need some buy-in. Um, and I won't get the buy-in if I'm the only holder of the data. And so the key has to be, how do we share the data in a way that is, and you have to be careful, right? Because even when you're sharing positive or negative, right? But when you're sharing data that's really not so good, and in some cases that's what I was sharing, then you have to be careful that you are not creating a culture where your key stakeholders feel like they are in trouble, or that they have done something wrong, or that now there's some negative consequences for the data, right? So you've got to manage the culture of that, because the goal is to positively impact the culture and create an opportunity where everybody has the aha moment and says, oh my, I see it now. I was talking and really sharing with one of my clinic supervisors, William. He started literally the same day that I did. So now we're a year in. We feel like we are rocking and rolling. He started at the same time that I did as the clinic supervisor over urgent care. And I wish I could have recorded the conversation because he had so many amazing points of how, the first thing that he said was, thank you. Thank you for pushing me to really learn the data behind the data, right? Thank you for pushing me to take the reports and not just see it as this tool to get the patients from the lobby to this, to that, which we use it for that, but also to understand what's truly happening in our clinics. And he said once he did that, he was able to study the numbers and the reports more holistically to say, how do we improve from the standpoint of patient satisfaction and increasing the level of, patients who want to come back and really impacting that. And some of the things that he talked about was, we've had a little contest of, making sure a patient is not in the room for longer than 15 minutes. And he said when he first started that, there was a little bit of resistance and pushback from the staff, right? Because they're saying, okay, urgent care facility, we have a process which we've implemented as a result of looking at our stat data where we are reducing, heavily reducing. So when I started, our patient total time in clinic was well over 60 minutes. And Alan, please don't bring out our real data. Don't share that. I'm embarrassed. But it was well over 60 minutes, right? And so we started just a goal of how do we get this average time below 60 minutes? Because who really wants to sit up in a doctor's office, especially in urgent care? You already feel bad. And then to have to sit there and still feel bad and wait an hour, hour and a half, 2 hours to get seen. Nobody wants that.
Yeah.
And so we started this process of, what does triage look like? So our anyone who comes into our urgent care, they're probably in our lobby waiting area. Our goal is 10 minutes or less. And then we started looking at deeper data and we realized that it's true story. Uh, Average patient in our clinic, and this was, when we started in the clinic, and let's say they were in the clinic for about an hour and a half, right? What we found is that the majority of that time, 40, 45 minutes, was really alone time.
Mhm.
So you got a patient sitting in your clinic for an hour and a half, number one, taking up space, right? Because now you can't get the next patient through because this patient's sitting there. And their alone time was really high. So again, and I can't say it enough, assumptions were there, but now I had the true data to say how much time are our patients just sitting there twiddling their thumbs? And
Mhm.
what are we doing to mitigate that? And as we started looking at the numbers, we realized there was more that we could do because the average time that a provider, urgent care, now I'm only talking urgent care, but the average time that our providers were in the room was 3 to 5 minutes
Mhm.
because they come in the door, they've got their triage. So now from triaging, the medical assistant is this is what I'm doing. These are the tests that we're running, whatever it is. We're triaging this patient and then we're waiting 15, 20 minutes on average for the test results to come back. And it's just a matter of getting the provider in there. So when we were able to analyze that, what we discovered is and what we've been able to do is reduce now that time to almost um, 40, 45 minutes in clinic
Wow.
for the majority of our patients. Well, what does that do for us, right? Think about it from this standpoint. We got a twofold thing that's happening in our urgent care. Alan, am I going too far? Because you got
You're
me
good.
up
No,
now.
no, you're good. You're good. I am going to ask, the question I'm going to ask is, it may be helpful just to hear how you as the CEO think about urgent care in terms of what it does for the business. Like, why is urgent care so important? So maybe as you're talking, I just want to make sure we tie to that because I think Happy Health has maybe a unique way that you utilize urgent care in order to improve both your patients' lives, but also the organization.
That is exactly where I was going, right? So, our urgent care facility, two purposes, right? Number one is just exposure. Well, let me back up. Number one is to make sure the patient is getting what they need, right? So, we've got this door open, urgent care facility to really address very quickly and to really provide a cost savings to the patient, right? It's cheaper to come to the urgent care than it is to go to your hospital ED. The good thing is we have a great relationship with our hospital ED. So when they are at capacity, sometimes they're sending patients to us. So we've got a great arrangement there. But the other piece of it is, what have we learned all of our lives about first impressions?
Hmm.
what we've learned about first impressions is you've only got one opportunity to make a great first impression.
Mhm.
And we are unique in that we are a urgent care facility, but we have other primary care offices. In fact, our urgent care facility shares a physical space with one of our primary care offices or clinics. And so what happens then is our goal for every single person that comes through the urgent care is if they do not have a primary care provider, we want them to become a member of our happy family. My urgent care is that opportunity to make that first impression. My
Mhm.
opportunity there is to show them the efficiency level. And with William and his team and what he's been able to accomplish, I got to tell you, in fact, we're in the middle now of running a clinic incentive program. And I was talking to my operations team last night. We're struggling because he has so adopted the process improvements that we get from this that his clinic is hands down winning every single competition and
Mhm.
it's an incentive. Now, the good thing is it's getting very competitive and getting very tight and so there are now best practices being shared, but it really gives us this great opportunity to say, how do we convert these patients, these urgent care visitors into patients of happy? And we're looking at now about a 27 to 30% conversion rate, um, which now allows us to not just serve that individual based on the urgency of what they need in the moment, but now to look at the totality of their healthcare needs and not just for them, for their entire family. And so it's been great from that standpoint, Alan.
Yeah, that's really cool. I think early on, and when I say early on, I think I'm talking, early 2000s, maybe even through 2010. I think there was a question of, okay, how do we think if I'm, a primary care provider, how do I think about urgent care? And do we try to partner with them? Do we try to build it ourselves? And I think what we've seen is that the most successful organizations have found ways to allow patients to flexibly, continue to maintain them as their medical provider where possible. Obviously, specialty, et cetera, it's going to be a little bit different. But if you're a primary care provider, it's a pretty crucial part of your role. I want to give you a chance here to talk about EOS, and just want to hear a little bit about kind of this framework that you use in order to prioritize and run the strategy of the organization.
Yeah, thank you for that. I am just a fan of the EOS system, entrepreneurial operating system, and really empowering our staff to take the tools that we have and look at how they impact the day-to-day operations, patient flow, all the things associated with that. And so with the EOS system, we're able to focus in on our vision, making that really the center of what we are reaching for. And so from a practical standpoint, what we do is, which is in alignment with that, the first thing is this is mandatory reading. And so when we hire a new employee, we share with them the model, the book, to help them understand how it works and how the structure of it really helps them improve in their own workspace and work areas. From a leadership team, we use it extensively. We we set every year what our annual goals are. Most folks do that, but we pull it into a scorecard feature that's in the EOS system so that when we meet weekly, every week we are looking at what are our annual goals and are we on track or off track based on milestones and interim metrics that we've put in place to track what that goal is. And then what we do is once those annual goals are set, we meet as a team offsite. So in fact, next week, we'll spend 2 days offsite, our core leadership team, looking at the rocks, which were our goals for the last quarter, to say, did we meet our goals or did we not? And if we didn't, why not? And we hold each other accountable to that. Meeting your goals is really about the intentionality of this is what I am going to accomplish in the next 90 days. And if I don't accomplish it, because we set that as something that was very important. So if I don't accomplish it, I need to be able to answer to my team why. Was it because that rock or that goal is no longer viable? Well, we should have detected that earlier on, or we should have known that and made the adjustments. Is it because I was distracted or I was this or whatever? And then looking through to help us identify what are the things that are really distracting us that we are allowing to eat up our time as it relates to our goals. And so we keep these scorecards. Within that scorecards are metrics and tracking the data. So we're looking at how many visits did we have? How many visits is our goal for the year, and where are we tracking week to week? Our no-show rate. And I have to pause and really talk about our no-show rate. I won't pause. I think it's in the slide later. But the EOS system really provides us an opportunity at strategic alignment within our team. We're all tracking on the same path. We're working from the same menu. We're working from the same sheet of paper to say, this is what Happy wants to accomplish in this year. And then we're feeding that back up to our board of directors so that they are on board and making sure that it is in alignment with what they would desire as well. It has become extremely productive. So when you combine these two pieces, I think the biggest part is the visibility of the data. It's the visibility of knowing that there's a dashboard there that somebody's looking at to say, how are we doing? What is our traction? And then it allows us to address issues on the go so that things are, when I arrived at Happy, they were having weekly staff meetings, but those staff meetings were a report off. Okay. Everybody goes around the room. This is what I did. This is what I did. Okay, great. I want to applaud you for that. But the truth of the matter is, you have issues that are facing you this week. So we want to highlight the things that we've accomplished. That's great. But then I want to look at what do you need to accomplish this week, and where do you need me? Where do you need the COO? Where do you need the CFO, right? Where do you need the clinic supervisor? And so we spend most of our time in the issues component, right? What do you have a question on this week? You got all the players in the room. What do we need to solve this week so that you don't have any barriers to accomplishing the things that you want to accomplish? Sometimes it's a policy. We'll sit at the table and we'll work through that policy until it's done. Not a bunch of emails going back and forth. We've got it finished. Sometimes it could be a process or information. It just doesn't matter. We're working through the issues. And then we track how many issues were raised? How many issues did we solve in this meeting? And it keeps us on time, it keeps us focused, and it keeps us accountable so that we are in a problem-solving mode and really looking at what are the challenges facing the organization, and collectively, how do we resolve them together?
Yeah, awesome. Yeah, I think in general, we see, kind of a homegrown attempt that, maybe touches on three of these things, right? And usually we've got annual goals, but usually those are, that's kind of the extent of it. So this is awesome. I want to maybe just talk a little bit about kind of results. I think this idea of patient reliability is something that is probably new. It's not something we talk about very much, and it's something I think is really critical to your success. So maybe Michelle, I'd just love to hear a little bit about obviously the numbers here, what they mean to you, why they're priorities, and then also just share a little bit of the story. How did you get here? How do you see these things happening?
The patient reliability is really interesting to me. And I think it highlights a little bit of I'm from a for-profit world and now entering the nonprofit world. And so, and I say that to say, When I speak about a 30% no-show rate, most of my peers and in my peer group, they're like, "Oh, that's good," and I'm like, "No, that's horrible."
Um,
And so we've just focused in on the importance of making sure that we're building our provider schedules with patients that are going to show up, and then eliminating barriers for those who want to show up but can't, whether it's transportation, babysitting needs, um, whatever those needs are, right? So it's a twofold thing, right? And so we're looking at that. But what has happened is our no-show rate. William, he and I met. We talked about it, and we bounced around some ideas on how do we impact no-show, and we put in place a process, rolled it out through the EO system process, and really worked with the rest of our team to do it. The result is a year later, we're at about a 12 to 15% no-show rate.
mm,
And that is huge. That's a 60% improvement in patient reliability. And so for us, it was combining the discipline of the analytics, and really making sure patients were seen, because when they're seen, there's better continuity of care. That gives us fewer gaps, especially if you think about. So, yes, we are a federally qualified health center. Yes, we see about 65% Medicaid patients, but we also see about 20% commercial insurance. Um, and if you're tracking in the commercial insurance world, we know value-based care is really, really, really important. And a part of that value-based care is making sure that patients are showing up, they're getting the visits that they need, they're getting their appointments, they're getting their medication refill, all of the things. And it's hard to do that if you're not seeing the patient. And so now this gives us an opportunity to say, we've got a better reliability here of seeing that patient. So the numbers are staggering for me in what we've been able to accomplish and how the system that we've built in to do it. The other piece of it, and this was personal for me, is the 700% turnaround in net income. And I say this because our patients are being seen. Our patients are getting the care that they deserve, that they need. The result is we are we are now able to see more patients and to improve the throughput through our organization because of how we are managing the tools that we have, the resources that we have, and the data that we have. Transparently, I was budgeted a year later, and I'm looking at the numbers, and I have to be honest, it's been an emotional week and a half or so. I'm gonna cry now to look at it and see the progress that we've made. We were budgeted to do to be at this point in the hole. Like we were budgeted to be negative six figures, and
mm,
um, and that was just based on what the company had done for the year prior. And today we are at like a hair away from seven figures in net income. And I want to highlight that, right?
um,
And so, what a huge swing, what a huge change there. But I know that it's because of our visibility that we've given to really saying honestly with ourselves, this is how we look. And is this the image that we want to have?
mhm,
Right. That even goes to, because you may ask, well, how does this impact? Well, patient satisfaction. I love the feature even within STAT that when a patient is sitting in the room, they can hit a smiley face or a sad face to rate that visit, right? And so we know real time how that patient feels about that visit. Guess what? That real-time notification goes to my phone, it goes to my COO's phone, and it goes to the clinic supervisor's phone. What do you think our staff is doing? We're walking in that room to say, what happened and how can we improve? And it's really just taken the responsibility of realizing that, yeah, we are honored to serve you, and that's what we want to do, is really serve our population at a greater and a higher level and ensuring that they get the care that they deserve. And so this level of deeper engagement, really looking at the core of how do we serve our community? How do we drive patients who want to be at happy? How do we do that and promote that? That's just been top priority for me.
Yeah. Well, I think this is such a cool story of saying, hey, we're going to focus on a specific subset of things. We can't boil the ocean. We can't do everything, right? But we know what matters, right? And we've got this, big, hairy goal that we need to accomplish, and it involves how we treat our patients, and it involves how we operate as an organization. And we're going to do things every day that drive towards that. What a cool story. Hey, I'm going to ask you one more question, then we're going to jump to Q&A, and we're going to miss some slides here. We'll send these out to everybody. But the question is, I think by my math, about 375 days in, right? We went September 6th to the 16th. And so I think my math there is right. Tell me a little bit about, what are you seeing for the future? Like when you think about, September 2025 and what you want to do over the course of the next 12 months, what are the things that stand out to you? What are you seeing and what are you feeling in your role?
Yeah, that's a great question. And I think it's important to note that this started off as a 90-day interim assignment while the board hired someone permanently, and I've just not been able to leave. So we are moving fast forward, opening another urgent care facility. We are in the process. In fact, milestone for us is we've applied last week for through the Alabama Board of Pharmacy as we are launching Happy RX. And so we will have two pharmacies in our clinics, really just to help with looking at, how do we serve our patient population deeper and better. So we've got two pharmacies that are opening. We're expanding behavioral health, looking at counseling, and I am in the process of writing an abstract for a core program that really feels near and dear to my heart. It's how do we work through substance use disorder for our adolescents? And so we are writing in the process of really developing a substance use disorder program for adolescents ages 11 through 18 that will focus on prevention, treatment, and education for educators, for parents, prevention for the individuals, the students that are in that arena, and then treatment. And so we're doing that in partnership with a couple of other organizations, but really feeling really strong about that and what it'll allow us to do.
Yeah, that's awesome. Well, I'm excited to see what comes next. Um, Open it up for Q&A if you have any questions. Love to see them in the Q&A section. Looks like we've got one here, which is how do you keep any of the three different perspectives we talked about? So kind of the patient perspective, revenue, the business, and then operations. How do you keep them in balance? How do you keep one thing from becoming more important than the other? It's also kind of a leadership question, right? How do you keep your CFO, your COO, your medical director, chief medical officers, all working together and not having one that's prioritized over the other?
I think our offsite quarterly sessions are really strong in doing that. And that really creates the synergy. So in our offsite sessions, the C-suite, the four of us, so it's, the COO, CFO, CMO, and myself, we spend the first day and the first 6 or so hours of the first day really talking through where are the overlaps, role realignment, re-engagement with each other. We do an exercise, and it's on the model there for EOS called right seat, right person. And making sure that we've got the right seat, the right person in the right seat, right? So it's more than just about qualifications but it's actually more about culture and are they a cultural fit for who we are today and the vision that we have for our future. And that's one of our key areas is just really making sure there's a base realignment at all times. Because all three are important. Serving the patient is critical, but guess what? No margin, no mission. I'm going to say that again. No margin, no mission. So if I don't create margin or margins in our delivery of healthcare, it's almost impossible for me to be able to serve our patients in the way that we desire to. No margin, no mission.
Yeah, awesome. Next question here. You may have touched on this already, Michelle. If you had one concept or thing we've talked about to implement, what is the biggest thing that leads to effectiveness in operations?
One thing, for us, I'm gonna say, and this is a little bit off the beaten path, but one of the things we've recently implemented is in addition to the EOS, we've been doing that for a year now, is really looking at DISC and looking at how do people communicate with each other. Our value system is really an integral part of what is helping us build who we are today. And so that means that there's a highlight of communication and how we communicate. There's a highlight of teamwork and how do we work well together. And so, a part of sometimes the struggle and the challenge is you can have an extremely talented individual but if they don't communicate and play in the sandbox well with others, they create a huge distraction for the team. And the vision is more important than for me to allow one individual to be the detractor. And so the implementation for me today is how well are we working together as a team, looking at the DISC assessments, really doing training around how do we communicate with each other with a focus on our vision and our mission. And then where we can, how do we create greater alignment? Where we can't, how do we release individuals to their destiny in recognizing that their destiny may not be at happy?
hmm Yeah, I think the a couple of things you've shared, and I was just thinking about that question. What I've observed would be twofold. One is a focus of just saying, here is the priority, here is where we are going. And then the second is accountability. I think when you get together and you say, hey, we had a big rock last quarter and it didn't happen, that's not, I can just imagine knowing your leadership team a little bit how that conversation goes. And I think that whole team is saying, man, we did not accomplish what we thought we would. This is disappointing. And what went wrong? Why? What happened to our focus, right? And so I think, when I think of what you've brought to the organization, I think those stand out to me. Well, I think with that, Michelle, any parting words of wisdom here for the team and for those people on?
No, the thing that I would say is, owning your mission, whatever that is rolling up your sleeves and owning that, never being afraid to take the assessments, because sometimes we don't want the light to shine on
Mhm.
where we are. But I think that illumination really provides a guidepost on what's next and how do we get there. And so, be brave, take those next steps, and realize that truly your patient base, your community, wherever you are, they're waiting for you to show up and take that stance and that stand and to deliver the care in a way that really supports, who you are and your mission and what you want to accomplish. And I would just say dig deeper and truly embrace your journey.
Yeah, awesome. Great. Well, thank you so much, Michelda. Thank you for making time. Thank you everybody for joining. We appreciate it and have a great Tuesday.
All right. Thank you so much. Thank you for everyone, the presenters, Alan and Michelda. And thank you to Stat.io, who's our premier sponsor. Again, be on the lookout for a survey regarding today's webinar, as well as an email with your CP HIMSS credits and instructions on how to claim those. We will also be posting this recording of today's webinar to our New England HIMSS YouTube channel, and we will post that link to the video on all of our socials. Lastly, if you'd like any of today's material, the slide deck, have questions, please reach out directly to Alan and Michelda. Thank you and have a great rest of your day.